Hi guys, good morning. Welcome to another AMA session with Dr. Ben. I'm Dr. Ben Behnam. I'm one of the co-founders of Happy.
Yes.
Welcome everyone. Welcome to another session with Dr. Ben. Today our topic is going to be if my family suffers from hair loss, am I prone to hair loss as well? And the answer is most probably yes. So a lot of basic male pattern hair loss is due to genetics. Environment also has a factor, based an influence on it, but genetically, a lot of the patients that lose their hair are genetically predisposed. So let's say that if your grandpa is bald, or like basically your dad is bald, or one of your uncles are bald, that means that there is the gene for hair loss in your family, and if you get it, that basically increases your risk of basically going thin or bald at some time in your lifetime. Now, what if no one is bald in the family? We have patients that come like, doc, my dad has great hair, mom has great hair, uncles with amazing hair, all the brothers have good hair, and I'm going bald. Well, what happened there? The reason is because it's possible that although your mom and dad have gray hair, but they still carried the gene, each one of them individually, but was not being presenting itself in a dominant way. And then both of those genes from mom and dad came together in you, and now you have two genes that are now presenting itself dominantly in you. So as a result, basically you go bald. So that's how the explanation of the male pattern hair loss goes, especially when no one else in the family looks bald. So guys, today we're on Crackcast as well as Instagram. So welcome everyone. So now we're gonna go to our questions of the day. So, can I use a happy on slightly wet or damp hair? I heard some valid sources that penetration will be better. Actually, not really. Actually, the penetration is about the same, but you could use it on damp or wet hair. I don't think it makes a difference. So you could use it on dry hair, on wet hair. You can really do basically whatever you want. We do like patients to derma roll on wet hair. So we typically tell our patients basically to put the Rogaine on and gently derma roll basically on top of that. So that one you guys could do again, but wet or dry does not make a difference. How can happy head be used as preventative treatment? So as a preventive method, basically where you just start using it when you have not really noticed much balding or thinning. But just remember that happy head contains prescription grade minoxidil, and minoxidil could sometimes cause initial hair shedding. So that's something that you should be aware of. But yes, you could use it preventatively. A lot of people would like to use it basically in the front, so you could use it basically in the frontal hairline as preventative, basically for preventive hair loss. Thank you so much for that question. Um,
What would happen if they're on a treatment and they stop seeing results? They hit a plateau in results.
Oh, this is a very good question. Actually, I asked somebody this morning basically who asked the same question. So he was using basically Happy Head for about 6 to 9 months, and after that, basically plateaued. So first, that could happen with any treatment. Even on oral finasteride, a lot of patients basically plateau after 6 to 9 months. That means basically what you have is what you're gonna get. So a couple of things you could do. One, you could switch you over to topical dutasteride, and since the different molecule, basically it might restart basically the hair growth process again. Or you could add oral finasteride to the regimen. So, and we have noticed that patients that are on topical finasteride and oral finasteride definitely do better at times. So if you're plateauing, basically adding another basically an oral or topical basically could help you basically restart the hair process again. But also you have to realize that sometimes even if you add something else, you're not going to get much more hair growth. So everyone's different. Happy it can use immediately after 0.25 derma roller, nightly. So basically, one of our patients is saying that when can one use the derma roller? So do you derma roll first and then apply happy head on top, or apply happy head first and do derma roll? Honestly, both ways are correct. We have noticed that when you apply happy head first and then derma roll on top, it actually might be better because the air is going to be wet, so you're not going to be pulling out some of your own natural hair. We typically recommend doing the derma roller at night. So apply happy head and derma roll on top of it. And you could definitely derma roll on wet hair. It's a good idea to derma roll on wet hair. Um, So is the order to use Happy Head first and then dermal roll, or dermal roll and then Happy Head? This is a very good question. Both ways are correct. Uh, we feel that if the hair is wet first, you're going to be able to dermal roll easier. So we recommend now to use Happy Head first and then dermal roll. I see that DHT is bad for hair loss, but is it actually good for hair everywhere else? If I use your product, will I experience low libido along with not having a thick beard as I do now? So that's a good question. So you're right. Your body does need DHT, and DHT in the scalp is the one basically that's bad. Um, the whole point of topical habit is that basically, since it is not affecting your overall testosterone level, the rates of sexual side effects are lower compared to oral finasteride, which means that sexual side effects could still happen. That means you can still have lower libido, but it's a lower risk compared to oral. Uh, so, so to answer your question again, so when you use Happy Head, you're gonna block DHT on your scalp. More likely, you're gonna get more hair growth, and more likely, you're gonna have low risk of sexual side effects compared to oral finasteride. It should not affect your beard at all actually. So just want to clarify that. Still getting side effects on the top of finasteride 0.25. What can I do? So a couple of things. So first of all, you can lower the concentration to 0.1% and use it not every day, use it every other day. Please contact help at Happy Head, and we will be more than happy to basically just change the formula out for you and ship out a new product free of charge. And actually, if what I would do, I would stop the medication first, let the side effects go away, and then restart the 0.1. And do not do it every day. Do it maybe twice a week or 3 times a week, once a day only. Once you do that for a few weeks, then you could slowly increase the number of days that you're doing it per week. So that's how I would do it. If you have any questions, feel free to reach out to us, and I'll be more than happy to guide you through that. What kind of supplemental products that may aggravate hair loss should I avoid? That's a great question. So typically, a lot of the protein shakes that are used for muscle building are the ones that are going to cause more hair loss. So, for example, um, pre-workout shakes or post-workout shakes that have whey protein isolates in them basically will increase your hair loss. Also, pre-workout vitamins that are high in arginine, valine, isoleucine, or leucine basically will also increase your testosterone level, leading to more hair loss. Soy milk is also going to basically cause an imbalance of testosterone and estrogen, so I will avoid that as well. Obviously, anabolic steroids, and energy drinks, those are the ones that I would avoid. I'm seeing results after 6 months. That's great. What's next? Well, just keep doing it. I wouldn't stop, especially if you're seeing results. I mean, you will plateau at some point. And if you plateau and you're happy with the results, that's great. We don't know exactly when you're going to plateau. Let's say if you do plateau and you want more improvement, then we could always put you on oral finasteride as well, as long as you're not having any side effects. Another patient asked, you said with respect to derma roller, nightly is okay for derma rolling at a 0.25. Also, can I use your product just once a day at night? Good question. So again, let me repeat the derma roller thing. So get Happy Head, apply it on 2 pumps, and then you're going to gently derma roll at a 0.25. Gently, do not make yourself bleed. Yes, you could use the product just once a day. You're just not going to see the most optimal result compared to if you were using it twice a day. But look, if you want to use it once a day, that's fine as well. Could this help with alopecia areata? So there is a study out that came out years ago that showed that if you use topical minoxidil along with derma roller, it should help alopecia areata. Traditionally, there have been studies in the past that showed it did not. So it's kind of the whole clinical studies are kind of conflicting. But I personally have had patients who have had alopecia areata and use Happy Head and got results. We typically do not recommend it, but if you want to take it upon yourself and use it, that's fine as well. It shouldn't hurt you, and it could really help you. Do laser caps work? Which one is the best one? That's a good question. So in my opinion, I think the laser caps work about 50-50, and it really depends on the laser cap. We are currently reviewing the market and doing it like a market analysis. So we should have that analysis soon where we think which one is the best, and also we're kind of trying to think, trying to come up with our own laser cap that is more effective than anyone else in the market. So let us do the market analysis, and we're going to let you know. But I do believe that laser caps do work, but only 50% of the time. If it's applied once a day, what is the maximum amount that I should use? 2 ml or 1.5? Typically, if you're only going to do once a day, I would recommend do 1.5 ml. I think if you use the 2 ml, you might increase the risk of side effects. I see that Happy is customizable. In what ways? I get the formula already. Just wondering if I could optimize it even more. So typically, the standard formula is the most common formula that's used in about 85 to 90% of patients. And the standard formula contains 4 different ingredients. 1 is finasteride, 2 is minoxidil, 3 is retinoic acid, and 4 is hydrocortisone in an aloe base. That is our strongest formula. Now, let's say, if you're having some sexual side effects, so we could reduce the finasteride for you. If you're having some little irritation, we could reduce the minoxidil concentration or take it out, or we take out the retinoic acid. So, everyone's different. If you're using the standard formula and you are not having any side effects, please reach out. If you're not having any side effects, keep doing it. If you're having side effects, reach out to us at Help and Happy It, and we'll then go ahead and customize the product for you from there. But if you're happy with it, don't change it. Does hydrocortisone really make a difference? That's a very good question, actually. So it's a very low amount of hydrocortisone. It is supposed to reduce some of the irritation. There are similar formulas out there with much higher steroid concentration. We don't want the steroid concentration to be too high. So yeah, it just reduces the irritation. If you don't want if the hydrocortisone in your product, please reach out to us at Help and Happy It, and we'll be more than happy to take it out for you. Can CBD or caffeine be added to the formula? Do you think they would help? That's a great question. Really, no one really knows about the CBD yet. So we were actually, our VP and operation and I this morning, we're talking about this. We're having a formal discussion about this. So, but let's definitely look more into it. Caffeine does help a little bit, so I think hopefully in our future shampoos we might add caffeine into it. Again, so those are currently under consideration. Thank you so much for that question. I've had 4 hair transplants approximately 20 years ago. The whiskers are okay, but my non-transplant hair has basically fallen out. So I use the plasma injections and laser cap, and I use a hair dye, minoxidil. If I start to use your product, will it cause hair loss with all that already I do? Well, here's the thing. So I like the PRP, the plasma injection. The laser cap, I think, is 50-50. Hair dye, as long as you are not going lighter, is fine. So if you go darker, hair is okay. Our product already has minoxidil in it. So once you start using our product, you could stop the minoxidil. And our minoxidil is stronger than the minoxidil over the counter. So we're 8% minoxidil compared to the 5% over the counter. Also, our product has retinoic acid in it, which makes the minoxidil stronger. And more importantly, our product has finasteride. So you're really combining 3 products in one. So it's more ingredients, stronger ingredients, and I think you will see basically better results. So I will highly recommend you start using Happy Head. Do it twice a day every day. Give it 6 months, and I think you will see improvements. Please take before and after photos so you could monitor your improvement. Thank you so much for all those questions.
What is the strongest formula that you've ever prescribed to someone for hair loss? Like maximum?
Maximum. So right now our maximum amount is the 0.25. We are currently finasteride, 0.25 finasteride, minoxidil 8%, and retinoic acid. We are discussing coming out with a stronger finasteride formula, possibly a 0.3, that is currently basically being tested. So, but once we come out with it, that will be listed on our website. So it's going to be the finasteride 0.3 with minoxidil 8% and retinoic acid. But that has not come out yet, guys. But I'm happy to say that we are out with our water-based formula. Our water-based formula is a propylene glycol-free formula, which is 80% just different botanical ingredients as the base, and only 20% alcohol, and is a special alcohol that is not irritating. So for patients that are getting some irritation, we do have the water-based formula. Please reach out to us and we will be more than happy to switch it out for you guys for free. What should I look for in a shampoo and conditioner? Great question. So, as you asked that question, I'm going to show you the happiest shampoo and conditioner. Now, I know all you guys are going to say, well, I've been on your website and I still can't buy it. That is correct. We are still updating our website because we want it to be the best, and we don't want to roll out anything that has any kinks in it. Thank you so much for your patience, everyone. So, guys, this is our thickening shampoo, and this is our thickening, and this is our thickening shampoo and conditioner. I use it too. My son, who is 4 years old, also uses this stuff. So the reason why our shampoo is so important is because, first of all, we made it. Number two, we sat down and compared all the shampoos that are already on the market. And we also looked at all the clinical studies. And we realized that there's certain ingredients that really work very well. More importantly, topical biotin and collagen. So this is basically your biotin collagen shampoo, but we also added argan oil, keratin, and saw palmetto. And honestly, this condition is really good. It has some citrusy feel and smell to it, and it's great. I try to keep this away from my wife because she keeps using a lot of it. So, but it's really good stuff.
What does it smell like?
It smells citrusy.
It's very fresh.
It's very fresh. Water-based formula is just as absorbent, and if it doesn't, and it does on our scalp just as well as a regular alcohol-based formula. Yes, yes. So the formula is exactly the same. You have to realize that in order for the different products to get absorbed into the vehicle, you need to have some alcohol. So our regular standard formula does have propylene glycol and ethanol in it, but our new formula is only 20% alcohol, and it's not ethanol and no propylene glycol. So it is less irritating. It's actually much more soothing to your scalp. So I do highly recommend it. And if you want to, please reach out to help at Happy It, and we will be more than happy to ship you a bottle. Does Happy have supplements like Nutrafol? Have they compared? That's a very good question. We do have actually our own supplements that is very not only comparable but better than the N company. I'm not going to mention them. So basically what we did was that, again, we looked at all the supplements on the market, and if you compare ours to Nutrafol, basically it's the same, except for the fact that we have a couple ingredients like biotin and I think the collagen that are just much higher in amount. So it's a much better basically supplement product. We are again, it's not basically on our website yet, but it will be soon. It's already been manufactured, and our distributor has it, but we are waiting to release it. If you want to, you could definitely go on a wait list, or just send us an email, say, look, I'm interested in the supplements, and we'll let you know. We'll be one of the first ones to let you know as soon as we have it. My plan is to use a nightly, Dermarol nightly with a 0.25 while wet scalp, and then apply the Happy 1 ml. That's perfectly fine to me. So basically, one of our patients is saying that he's gonna wet the scalp first, then apply then Dermarol and apply Happy on top. He wants to apply the 1 ml. You can do 1.5 ml, but I'm fine with that. I've heard that rosemary extract is as effective as minoxidil. Would you recommend to adding it to Happy It or Happy It shampoo? We are considering adding it to our future shampoo formula. Yes. Again, the things that we're concerned to add is caffeine, possibly CBD, possibly rosemary oil. So we definitely have a list. Emily has a list right here, and honey. So, but thank you so much for that recommendation. We're working on it. Is switching to topical from oral and vice versa a bad idea? Would you lose your hair? So no, it's typically not a bad idea. We actually have a lot of patients in the office that are on the oral finasteride that just want to get off, and they go on topical and they do very well. Now, please remember, That usually patients should really not have much side effects. They should not have much shedding. But please remember that there are some patients that are on oral finasteride and they plateau. And then basically then they start using topical, and all of a sudden basically it just reignites the hair and really they get a lot more hair growth. The reason is because sometimes when you attack the hair loss from multiple different angles, you do get better results. So patients that are on both oral and topical do sometimes see better results than are being on each one of these individually. So we do have the topical happy head, and we also do sell the oral finasteride. If you want it, please reach out to us, and we'll be more than happy basically to get you started on that. And now a question from Instagram. I switch. So one of my patients said that he started to do the 1.5 ml at night, and he got itchy. He got itchy scalp. Look, that is normal. That could happen. So one, this is why we recommend doing the 1 ml twice a day and not doing everything all at once at night. But if you are having the side of the itchiness on the scalp, please reach out to us at Help a Happy Head. We're going to switch out your formula to the water-based formula, and that should reduce the irritation. The water-based formula is 80% botanical product. Actually, I don't think it has rosemary oil, actually, but you have to look into that actually. It's 80% botanical products. I know it's definitely some lavender oil, and it's less irritating. Do you think those silicone massage tools help? I think a little bit. I think the derma roll is definitely much better. Oral minoxidil versus topical minoxidil, which is more effective? Why? That's a very good question. So I actually prescribe a lot of oral minoxidil in my office. I think it's really what your intentions are. Look, some patients do not want to go on the oral minoxidil because it could potentially have slightly more side effects. So a lot of people prefer the topical. I think the oral could be more effective. Yes, it could. And I think if you do the oral and topical, you could even have more effectiveness. So I have patients that are using Happy Head, and after 3 to 6 months, we add them on oral minoxidil at a very low dose, and they do see better results. Remember, combination therapy, people see better improvements. So if you're doing the topical Happy Head with oral, you get better results. Now, there are two oral medications. There's oral minoxidil and oral finasteride. There are some patients that still want to stay away from oral finasteride, despite the fact that they're using topical finasteride with no side effects, and that's okay. So if you feel you use the topical Happy Head for 6 months and you're doing great, but you want to see a little bit better results, then you could go on oral minoxidil. The way I dose it is that the pill comes in 2.5 milligram tablets. We tell our patients to get a pill cutter and cut it into fourths. So then they're taking they start by taking a fourth of a tablet for the first 2 weeks, and then a half a tablet for the first 2 weeks, and then a full tablet basically after that. Also, you could buy blood pressure cuff, and you can measure your blood pressure to make sure your blood pressure does not drop. Side effects of oral minoxidil includes the same thing as topical, which is headaches, heart palpitations, drop in blood pressure, and very rarely you could get ankle swelling. And if that happens, please definitely let us know. What products do I buy first? And I need a water-based formula because I get itchy scalp easily. Is the water-based less effective? How many times a week should I wash your hair? And what is the best shampoo I should use? So first of all, the water-based formula is as effective as the regular formula. So it's the same products in it. It's only the vehicle that's different. So it's as effective. If you have sensitive scalp, I would start basically with a water-based formula. Reach out to us, and we'll get you started on water-based formula. With respect to how many times you wash your hair, I would probably, you could probably wash your hair every day with a shampoo. The best shampoos are the biotin collagen shampoos. Happy Head, we have a great biotin collagen keratin, arganol, and soft palmetto shampoo. It's actually really good. We also have the conditioner with it. You will probably you will probably get a sachet in your next order with some of the samples. And then someone asked another question: is there a pill to use? Well, there is the oral finasteride pill, but again, remember, oral medications have a much more higher risk of side effects. So I was probably start with the topical and see how you do. Give it 3 to 4 months. If you want better results, then you can always add the oral. Just reach out to us, and we'll be more than happy to add the oral to your regimen. I'm on oral minoxidil 10 months, suddenly major shed. I'm a female. Do I need to increase or add oral dutasteride? I have long hair, so topicals are a lot for me. I go through very fast, and it makes my hair look very thin. So, number one, what is basically this patient has been on 10 months of oral minoxidil and all of a sudden start to shed. Believe it or not, that's actually normal. You're going to go through many different hair cycles. So I have patients that use the products oral topical for 6 months and all of a sudden going through a shed. There are many reasons why you're going to start to shed: stress at work, stress at home, so a lot of different things. So and also really depends on what dose of minoxidil you're using. So if you're only using a quarter of a tablet of minoxidil, you could go up to a full tablet. And if you're a female above 50, you could add oral finasteride or oral dutasteride to your regimen, or even oral spironolactone. So everyone's case is different. If you want to go over your case individually, I'll be more than happy to discuss it with you. Just email help@happyhead, and we'll be more than happy to arrange that for you. Can I get a fragrance-free version of the shampoo? I have really sensitive skin. I'm so sorry. First of all, our shampoo currently right now has very minimal scent. It has a very slight citrusy scent, but really not that much. Um, but unfortunately, the shampoo is not customizable. So, but you should probably get a sachet in the mail and try it out and see if you like it or not. Another doctor told me not to wash my hair very often. Yes, typically we recommend anywhere from 2 to 3 times a week. Kind of every other day, I think is perfectly fine. I'm on the 1.2 milligrams, so I'm assuming of finasteride. Is latanoprost helpful? So, that's questionable. I know a lot of people love to add it. There was a study that Allergan did, which is the company who makes Latisse, and they saw that actually latanoprost, basically on the scalp, was not helpful at all. So they pulled out of the clinical studies, and they did not make that product. So based on clinical studies, it is not very effective. That's why we don't really have it yet in our product. But that's something that in the future we might consider. Again, she's saying that she's on a 1.25 milligram minoxidil. So that's a good dose. So if you're on a 1.25 milligram minoxidil and you don't have any side effects, I would probably go on. So every tablet is 2.5 milligrams. So you're taking half a tablet. You could actually up your dose to a full tablet and see if you get better results. Or you could also go on oral finasteride, and Happy It does have oral finasteride. How do I get these samples? We do have the shampoo and conditioner sachets that goes out in all the orders right now. So you should be getting one soon. What sachet you're speaking of? Yes, so our shampoo and conditioner, these are it. We are including free samples of those sachet in all of our products, and you should get it soon. Here we go. Thank you, Eric. So these are the sachet. You should get these in your box, basically with every order. There's one that says conditioner on it, and there's another one that says basically shampoo on it. So definitely try it and let us know how you like it. And if you want to order it, I know we still don't have it on the website yet, but reach out to us, and we'll be more than happy to place an order for you through the customer service. Just send us an email at help@happyhead. And also, again, I'd love to get your feedback. We had a couple of patients last week that gave us their feedback on the shampoo and conditioner, so definitely please let us know. So our patient asked, she's on the 1.25 milligram oral minoxidil, but cannot take finasteride. She has severe depression and didn't work at all. So she's considering doing a topical dutasteride. Okay, so again, you have more room to go up on your oral minoxidil. You can go to a full tablet a day. If you had depression on the oral finasteride, remember, you could still get depression on dutasteride as well. So I would please be careful. You could order topical dutasteride, but the side effects of dutasteride and finasteride are pretty much the same. So just be careful, and I would not rush into using it like every day. I would probably do it every other day, maybe one pump only, or maybe even once a week to see how you do. And if you do get depressed on it, please stop the medication. Um, I get Happy through your prescription service. Is there a difference getting it through Happy? No, I think it's the same. It's the same product. Any deals on buying multiple bottles? Yes. I'm going to have Evelyn respond to you. Yes, you could get 3 to 6 products at 6 months supply at cheaper price. Um, I have a low blood pressure, so is oral minoxidil is more oral minoxidil safe? Well, you should buy blood pressure cuff. It's like $20, and to go up and titrate up on our minoxidil, just measure blood pressure and see how you do. Typically, patients do pretty well up to a full tablet a day. We really haven't had much issue. But again, if you only weigh like 80 pounds, you probably should not go up and just um, try the topical minoxidil with dutasteride. My order just went through for my prescription. Can I update to water-based? Yes. Please send us an email right now and tell us to switch it out to water-based formula. I will. If the order has already been submitted, you can't make changes.
There has to be 3 days before at least. To reach out to make changes for the order. We can try to reach out to the pharmacy.
Yeah. What? Okay, we'll send. Well, Evelyn says that. Okay. Well, why don't you send us an email and we'll try to reach out to pharmacy, see if we could change it for you. Because sometimes, as soon as you send the order, the pharmacy really starts making it. So please just let us just reach out to us and we'll try to see how we could do it. So glad I learned of you. Looking forward to learning more. I'm a hairstylist, very helpful, especially if I can save my hair. Great. Well, please reach out to us. We sometimes have a special program for hairstylists that you could refer our product to your clients. So if you reach out to us and we could see what we could do to help you, your customers, and also help us. You have a twin brother. Where he's at? Yes, I do. Yes, Dr. Sean is my twin brother. He looks exactly just like me. He's currently in surgery, so he does a lot of hair transplant surgeries. We're both located on the west side in Los Angeles. But yes, I do have a twin brother. All right, guys, I'm just going to go through our Instagram and see if there's any other questions. So I'm using Happy Head for now and notice a significant hair growth. When do I stop the treatment? And if I stop, my hair will start to lose out again. So that's a very good question. So just like any products, once you start these products, you basically have to use it. And unfortunately, if you stop, the hair basically going to start to lose your hair again. You could titrate down. That means instead of using it twice, you could go down to once a day and see if that could maintain your product. Then another patient asked on Instagram, do you lose your hair faster when you stop the ingredients? No, there's no such thing as rebound. So let's say if you were using Happy Hair for a while and you stop, you're not going to lose your hair fast. You're just going to go back to where you would have been if you have never used the product. So let's say you're using Happy Hair for 10 years, and if you never use it, you would have gone bald. So if you stop using Happy Hair, you're going to go bald, not because Happy Hair made you go bald, just because you would have gone bald if you never used it. So I missed what he said, but the drug that you take topically does it not give you side effects? Look, topical finasteride could still give you some side effects, but it's just lower since you're not taking it orally. When applying the solution, should my scalp be wet or dry? It doesn't really make a difference. You use it on wet hair or dry hair. I heard it's good to use the Happy Head minoxidil with a conditioner. Yes, if you use it with a conditioner, you can have less irritating. So you use a leave-in conditioner or just a regular conditioner basically that you have, or the Happy Head conditioner. Okay, guys. Well, thank you so much for joining us on another Happy Head basically AMA with Dr. Ben. Thank you so much for Evelyn for basically posting all the questions and helping us basically with all this, and also to Eric, VP of Operations. Any questions, please reach out to us. Please try to leave us a feedback on on our page or on a trust pilot. We really do appreciate it, and your feedback really counts a lot. Thanks so much on Instagram for joining us. Again, guys, any questions, reach out to us at help@happyed.com. Have a beautiful